Good day, everyone. We are the Group 1B of BN3C. I am Kate Crystal Delgado, the leader of the group, and my members are JP Casper, Robert Castel Jr., Stephanie Quaicong, K. Francis Dawis, and Pauline Marie Ibanos. And today we will be defending our research entitled Emotional Intelligence and Quality Patient Care Among Nurses. Now, it is fair to wonder why we have chosen this particular topic to deal with, and here is the answer. Filipino nurses are globally competent in providing quality nursing care. One of the competencies that is being practiced is by communicating with patients with deep and genuine concern. The incorporation of emotional intelligence into work has an impact on fulfillment, stress, burnout, and makes a difference in promoting a positive environment, according to Ragubir 2018. As future LaSalle nurses, the researchers pursued this topic because this study can be a way of getting a deeper understanding of emotional intelligence that can lead to enhancing personal and professional relationships with patients.
For the objectives, this research aimed to determine the relationship between the degree of emotional intelligence and the extent of the delivery of quality patient care among LaSallian nurses. Number 1, what is the demographic profile of nurses in terms of age, sex, and years of experience? Number 2, what is the degree of emotional intelligence of nurses? Number 3, to what extent is the delivery of quality patient care among nurses? And lastly, number 4, is there a significant relationship between the degree of emotional intelligence and the extent of the delivery of quality patient care among LaSallian nurses? For the hypothesis statement, there is no significant relationship between the degree of emotional intelligence and the extent of the delivery of quality patient care among LaSallian nurses.
The theoretical framework. This study will be anchored by Jean Watson's theory of human caring and Daniel Goleman's theory of emotional intelligence. Jean Watson's theory of human caring states that caring values of nurses will influence human growth and to further develop the profession, management, education, and study of nursing. Daniel Goleman's theory on emotional intelligence is a group of skills and abilities that concentrate on 3 capacities: self-awareness, management of relationships, and social awareness. The conceptual framework. The 2 key variables of this research is the independent variable, which is emotional intelligence, and the dependent variable, which is the level of quality patient care. The demography of staff nurses is our interfering variable, a factor that can affect our independent and dependent variable. This study is conducted to identify if there is a significant relationship between the emotional intelligence and the quality patient care. The significance of the study. The results may be beneficial to the following. First, the USLS administration. The results of the study may serve as a basis to assess student nurses and their emotional intelligence as it contributes to the future success in the field of nursing. Second, to the clinical instructors. Findings of the study will serve as an eye-opener to the clinical instructors, which can be made basis to establish programs and trainings for student nurses that will focus on emotional intelligence and patient care. Third, to the registered nurses, the study will help raise awareness to the importance of emotional intelligence and it will help them to ensure improve in their nursing performance. Fourth, to the patient, the results of the study will help improve patient satisfaction in receiving quality care from nurses. Fifth, to student nurses. This research will serve as a guide to the student nurses on how to manage and use their emotional intelligence to improve the delivery of patient care. To the future researchers, this study will serve as a guide for further studies to be conducted in the future.
Methodology. The research design used in this study was qualitative correlational design. The participants of the study were the 30 LaSallian nurses or the nursing alumni of the University of St. LaSalle. The sampling technique used was uncontrolled quota sampling. Instruments used were 2 standardized survey questionnaires. First is the Genus Emotional Intelligence Inventory Short for the validity and reliability. The mean subscale reliability for internal consistency ranges from 0.71 to 0.85. It has a reliability coefficient of 0.83. Second is the 6-dimension scale of nursing performance. For the validity and reliability, 30 questionnaires were given to the 30 participants in a pilot study. Cronbach's alpha coefficient in the study was 0.90. Statements 1, 2, and 3 was analyzed first using descriptive statistics that shows the mean, standard deviation, and frequency distribution values. For statement number 4, Spearmint rank order correlation was utilized. Ethical considerations. First, principle of non-maleficence. This study means no harm. Second, the principle of autonomy. Upon the approval of the chosen Lasallian nurses, a letter of consent was sent to them before the conduct of the study. Third, principle of beneficence. The purpose of the study was briefly discussed to ensure that all the relevant information needed were understood by the respondents. Fourth, principle of justice. All data were kept inside a password-protected file until the end of the study before being discarded.
The results. Findings of the study shows that 50% of the participants of the study belongs to age 21 to 30 years old, while the least are nurses aged 51 and above, which represents the 10%. Based on sex, the highest proportion, which is 73%, indicates that there are more female nurses compared to 27% of the male nurses. In the years of experience, most of the participants responded to more than 10 years of experience, which is 37%. The computed value of 4.03 reveals that the degree of emotional intelligence of Lasallian nurses is generally high, with a very high extent interpreted value of 3.59 in the delivery of quality patient care. Based on the statistical value, the researchers rejected their null hypothesis and affirms that there is a significant relationship between the degree of emotional intelligence and the extent of quality patient care among Lasallian nurses, having a positive moderate association with p-value of 0.036.
Conclusion. The researchers have arrived with the following conclusions. First, Lasallian nurses have the ability to recognize how emotions drive behavior and impact people at work both positively and negatively. These characteristics reflect emotionally stable Lasallian nurses. Second, Lasallian nurses are able to deliver very high-quality patient care. They were able to interlace their empirical expertise and clinical practice to offer the highest level of patient care. Lastly, there is a significant relationship between the degree of emotional intelligence and the extent of the delivery of quality patient care among Lasallian nurses, having a positive moderate association. This means the changes in the degree of emotional intelligence are also associated to the changes in the level of quality patient care, however moderate. So for our recommendation, in view of the findings of the study, the following recommendations are proposed. The result of the study shows a significant relationship between the degree of emotional intelligence and the extent of the delivery of quality patient care. However, the relationship is moderate. Therefore, the study should be replicated to incorporate a larger sample size of registered nurses at varying hospitals to determine the consistency of the result. And lastly, hospitals and school administrators and nurses should develop training that enhances the emotional intelligence and be aware that emotional intelligence is one of the important key factors in delivering a high extent of quality patient care in the clinical setting.
For the utilization, study results were relayed to the 30 Lasallian nurses who were the participants in the study. A copy was endorsed to the Dean of the College of Nursing upon completion of the study as basis for program evaluation. The data will also be available to serve as basis for various institutions in developing and implementing programs and trainings that enhances emotional intelligence. For the acknowledgement, the researchers would like to address their deepest gratitude to the Dean of the College of Nursing, Ms. Ivy G. Adamni, for her unwavering support in this study, which was completed in the midst of a pandemic. To the chosen Lasallian nurses for their time and effort, as well as their involvement and support throughout the study. Their contributions are sincerely appreciated and gratefully acknowledged. To the panel members, Dr. Jobert P. De Los Santos, Dr. Tony Ann Villa Chica, and Ms. Marybeth P. Diva for their critical judgment and evaluation as to the improvement of the research study. To the facilitators and instructors of the research subject, Dr. Shaila M. Trajera and Dr. Leslie E. Young for their support and encouragement during the study. They have been providing inputs to the researchers which have been extremely helpful in the development of the study. The researchers would like to offer their sincere appreciation for the learning opportunities provided by these instructors. As we bring our research to a close, we once again thank you for allowing us to be here and hope that this presentation has given you a much clearer understanding of the relationship of emotional intelligence and quality patient care among nurses. Once again, thank you and have a great day.